Well, this has been an incredible day, and there's a lot to absorb. And I hope that all of you come away with at least one thing that you will do differently tomorrow as a result of what you've learned from some of these speakers and from each other today. Because I think hopefully you enjoyed our roundtable exercise. I certainly did. I learned quite a bit and got to know some new colleagues who had some great ideas. And I think it's so important for all of us to come together all the time and really talk about these issues in as candid a way as possible. So I really appreciate all of you for coming to join us in that effort. So I wanted to share a couple of reflections just from my own experience of today. One of the take-homes, I think, for me, is that in patient safety, we do talk a lot about clinical issues. We talk about pressure ulcers. These are clinical problems, and we have clinical best practices to address them, protocols that we know of to address them. But what came out of today more than in fact, we barely talked at all about what those clinical protocols are today. What we talked about were other kinds of things that are softer, so to speak. Communication, being honest, the idea of dignity for the patient, of thinking about the patient first. I know Joe Chiani talked about transparency, telling the truth, candor, apologizing to the patient. We had our panel with the stories from our two patient activists. Both of those stories were stories about being overlooked or feeling not listened to, of their needs being dismissed, their concerns not treated as priorities. And that was the take home for me, that the way that we deal with each other as human beings is extraordinarily important, because we know we're all going to make mistakes. We know the healthcare system was never going to be perfect. It's never going to be error-free, but we can do a much better job of talking to each other in dignified ways so that we manage through those human vulnerabilities that we all have. I think the second panel talked a lot about that from a different perspective, from that of the clinicians and the stress that clinicians went through during and after the pandemic, and the trauma that many experienced, either from the pandemic or just from daily life when dealing with a very stressful time in our nation's history. And they're in the middle of its most vulnerable center. And that was traumatic. And they had to work through that, and they had to be able to talk about that, and mental health became an issue. So the ability for us to talk to each other and walk through very difficult situations together may in fact be a critical piece of patient safety that will be the key to our resilience and our ability to get through the next pandemic without having another complete disaster of a spike in infections and increased rates of everything in the universe known that can possibly happen terribly to patients. We don't want a public health emergency to spark another public health emergency in patient safety. We want to be able to get through it and be resilient and work together to change systems very rapidly, even in rapidly changing times. And to do that, by building trust with each other, as workers and as patients. And by the way, as employers and as others who are outside the healthcare system looking in, wanting to be helpful and also wanting to expect change. And I think we can do that. We have to talk to each other well and candidly. So for me, that was a take-home, something that came through for the whole day. And then Dr. Bates did get us back to basics. Like, here's all the things we know about that happen all the time in healthcare. Here's some transformative new technology that other industries are already using. We're late to the game. We could be using them. We could standardize a lot of this care. We could reduce some of the stresses on the healthcare system to have to manage through all of the problems that can happen in healthcare. So I do think getting back to basics was another major take-home for me today, is we need to get back to basics. We need to help each other get back to basics. And I think what we're seeing is hospitals are getting there, but that has to continue. And we, as from the perspective of employers, the perspective of consumers, we have to foster that, expect that, and work with hospitals to make sure they get there. We also talked about health equity. That came up quite a lot today. Leapfrog has done work on that, as I mentioned earlier. What I think is really important about understanding the impact of health equity on patient safety is that, at least for the events that we were able to investigate in our research with Urban Institute, and AARP funded this, by the way, what we were able to find was that there were certain events where the disparity between, for instance, Black and white patients could be attributed to nothing other than the care they were receiving within the four walls of that hospital. So an example would be pressure ulcers. I believe it was twice as often that Black patients were twice as likely to get these stage 3 or 4 pressure ulcers. Stage 3 or 4 pressure ulcer, as you all know, is an excruciating event that shouldn't happen. And so the patients that we were able to look at were in the same hospital, coming from probably the same geographical locations, since they were all at the same hospital, and they were similar. We tried to control for them being somewhat similar in their economic backgrounds. They had the same payer, and we still found this rate, this twice as often. And so what that tells us is within the hospital, there's something happening, and hospitals do need to be able to look candidly at that. It's a very uncomfortable thing to look at. It's very uncomfortable. But that is something that hospitals do need to look at. I think we talk a lot about social determinants of health and some of the other factors that contribute to health inequity, which are absolutely true. They are absolutely critical to understanding health inequity, but there are things that hospitals can do today while we are solving the food desert problem, and we're solving all the other problems outside the walls of the hospital. There are things hospitals must do today to improve health equity. From the point of view of patient safety and the point of view of Leapfrog, we really want to see far more effort around patient safety and health equity, because we believe that's an area where we can see real change right away. And we know hospitals like those in this room that are extremely high performers who know how to do this. Which brings me to my third observation about today, which I think is just a really important framing of the way we want the healthcare system to think about its job. And that is that the patient needs to come first. The patient needs to be the first thing we think of, and then we think about, well, how do we serve them best, and everything flows from there. So that sounds obvious, but I mean, it really hit me when Stephanie talked about her breakthrough moment in her career was when she said, wait a minute, why don't we design the environment of care, literally the architecture of a hospital, around patient outcomes? Why don't we start with the patient outcome and then build a hospital around it? That's not normal thinking. That's not how we think in healthcare, and we need to. But that's true of everything that we're doing. Everything should start with, what do we want to achieve for the patient, and then will that AI contribute to it? Will that new practice contribute to it? Will that new revenue cycle management tool contribute to it? Are we getting better and better and better for that patient in every single thing that we do? And I think that came out in every one of the panels. It came out in every one of the speeches today. In some way or another, let's look at the outcome for the patient and start there. With the technology and AI, what scares me is that very rarely is technology thought of that way. It's very rare that I hear about technology. We started by thinking, how can we get better outcomes for our patient? And then we figured out what we needed to invest in for technology to do that. That just simply is not the way it's done. It's done more like we need EMRs to streamline and make things more efficient and blah, blah, blah. All kinds of reasons. Those are not bad reasons. But they don't start with the patient. And that's where it does need to start. And that's, by the way, what other industries do. When you're building a car or you're building an airplane, you do have to start with, how do I get the best possible product to my customer? Best airplane, the best car. You don't start by saying, well, I want to be really efficient in this factory. Or I just want to do things better so that the workers are not annoyed by a lot of the different things going on that distract them. You start with, we want to build the best car in the world. And then we want to do that in a way that makes it possible to do that, and that means the workers have to be not annoyed. But you're starting with the car. We need to start with the human being in the bed. So I think that to me is also a reminder of its importance and a reframing of how we think about what gets done in healthcare and how we do it, how we set our priorities. And I say we because we're all part of this healthcare system. Whether we're a patient or a potential patient or a patient next year or our loved one's a patient, or we work in the healthcare system, you're also patients sometimes too. We're all part of this, and we've got to work together. We've got to work better together for the benefit of the patient. So with that, I want to thank you all for being here today. And I want to say a few more thank yous, and then we'll do the drawing, which I suppose we could skip the drawing. Who cares, right? Okay, all right, we'll do that. Okay, so I want to thank our sponsors. Our sponsors made this possible. I want to thank someone who has brought us a lot of re-engagement around our sponsors and brought in new sponsors, new people to be involved with Leapfrog. Paul Alper has been just wonderful for us. Thank you, Paul. And Paul himself was a partner for 3 different organizations over time, and then he's now helping us to really build these relationships with some of these remarkable, I hope you found them, remarkable vendors that we see out there who are really driving change in healthcare. So we're very proud to have them here today and sponsoring our meeting. And then I want to thank our staff again. This is just an extraordinary staff at Leapfrog, and we are very, very fortunate. So can I have anyone who's on staff in the room right now stand up, please? I hope you noticed that was a small number of people. Some of them are outside, but this is a small staff and a mighty one. As you all know, we are just incredibly effective with a very small group of highly dedicated and very smart people. So we're just so thrilled to have them with us. And then our board, could I have the board members stand? We also have a mighty board. Always, that is one of our secrets at Leapfrog. Our secret sauce is just a very dedicated board that has made it possible for us to take some bold steps that otherwise we might not have been able to do. So, and have led us in directions that really are cutting edge and change. When you want to make change, you have to do things that haven't been done before or have been done different, or do them differently than everybody else does it. That's something our board has really pushed us on and has always been a leader in. So we take great pride in our board, and they are really important to Leapfrog's present and future. And then I also want to thank our top hospitals. We'll have lots of time to honor you, but I do want to thank you. You are really an inspiration for us. We do a lot of work at Leapfrog to talk about how hospitals are doing across the country, to look at individual hospitals, to point out where they can do better, to show that to the rest of the citizens of our country, to say this is how hospitals are doing. That's what we do, but where we find incredible reward is when you show us what excellence looks like. When you show us that you care so deeply that you're going to participate in the survey and that you are going to show the world that you can actually succeed and excel. That is what makes us proud of you and proud of what we do at Leapfrog, and a believer that we are going to get better as a country. We have to believe in the future of patient safety. We are going to get to zero. We are going to get where we want to be. And we know that because of you. You convince us every year when we do this. You convince us that this is possible. And then finally, let me thank our fearless MC. Steve Burrows has always been wonderful. It's wonderful to have a Hollywood guy as your MC. This is very high, this is high class for us Washingtonians. We don't usually get Hollywood people. But also someone who so deeply cares and you've walked some very difficult roads and some very difficult journeys. You've shared them very openly with the world, which we think is courageous and we have benefited from enormously. And at the same time, you bring great meaning to this work, and you bring yourself to this, which we appreciate. So thank you, Steve.